The mission of the Delaware Hispanic Commission is basically to advocate for the Latino community, and it's also to bring government agencies to the Latino community, as well as bring the community to those agencies, as well as nonprofit organizations. The reason it's important for everybody to participate in the Delaware First Latino Summit is, do you want to know who Latinos are? What are their dreams? What do they care about? How can you help them, and how can they help your community? So that is the purpose of being there.
My name is Sonia Aguilar, and I am the Vice Chair for the Delaware Hispanic Commission. I am also the Chair for the Subcommittee on Economic Development, and I work for the State of Delaware as the Workforce Development Director for the Delaware Economic Development Office. I'd like to share some statistics with you. Since 2000, Delaware Hispanic Commission has risen by 133%, while Delaware's total population increased by 19%. Delaware's Hispanics are employed in jobs like management, business, science, and the arts, as well as computers, education, and healthcare. In just 7 years, employment in these areas rose by 55%. In 2002, Delaware had 879 Hispanic-owned businesses, and within a 10-year period, 2012, grew to 1,553 businesses. Nearly 77% increase, and it is projected to continue to grow. Programs and services are now directed to the needs of the Hispanic community, but they're not keeping up with the demand. Hispanic population is relatively young. The median age is 25, and we are known for our excellent drive and work ethics. We need more educational programs and training directed at skill development and business entrepreneurship.
I am Charito Calvache Mateico, co-chair of the Delaware Hispanic Commission. I am also the chair of the Community Subcommittee, therefore the chair of the Hispanic Heritage Month at the Swart Center. And I am the executive director of the Latino Initiative on Restorative Justice. 1/3 of the population of USA are Latinos. They are the rising segment of America's economy and culture. Delaware is preparing for the new phase of America. I come from a family of 12. 6 of us are U.S. citizens in the field of technology, finance, international business, and law. As the members of my family, Latinos are innovators, entrepreneurs, with a strong work ethic and strong family values to succeed and make America richer. Si se puede. Yes, we can.
Hello, my name is Rita Landgraf, Governor Markell's Cabinet Secretary for the Department of Health and Social Services and a member of the Health and Social Services Subcommittee of the Hispanic Commission. We are here today to promote healthy communities where Hispanic Delawareans can have a brighter future by focusing on health equity, access to services, and increasing the availability of culturally competent and multicultural healthcare professionals. Our mission is to develop policy recommendations and to implement health and social services programs that provide education and resources to ensure access to healthcare and social services. These services will promote health and well-being among all the people of Delaware. Here are some of the key priorities. We are focused on behavioral health, including addictions. We're focused on access to healthcare resources and education. We're focused on building a healthier workforce capacity. We are examining the influence of secondary factors on healthcare, including linguistics and culture, services, and social determinants. Together, we will work toward a healthier Delaware for all of us.
I'm Rosa Colon Colaco. I'm the Senior VP for Learning and Diversity for Christiana Care, and I'm very honored to be the chair of the Delaware Hispanic Commission Health and Social Services. By 2030, there's a big prediction that 28% of the Delaware population will be people of color. Right now, 12% of the Delaware population speak a language other than English at home. So that is a priority for us to better understand what is it that we can do for our communities to serve them better in the health and social services area. You will wonder, what is this committee doing? It's very, very simple. We are concentrating in promoting health, defining healthy communities for you. That's very important, something that we cannot do if we don't partner with each of you to learn what are your needs, what are the barriers, what are the strengths into what we're doing today, and also partnering with the government to make sure that we provide the right services that you need. There are some key priorities that I'm sure will be of interest to you. Number one is mental health. Sometimes I get email from families that are really searching for help in this area. We know we may not have enough resources, or we may not have bilingual staff to do that. That's one of our key priorities. How can we increase the number of health professionals that are multicultural, bilingual, that can serve our community? The other area that we're also concentrating is resources. You may not know where to go, so you're not alone. So we are trying to make sure that we understand what are the kind of resources that you will need so we can find a place. It may be a website, it may be a location that you can go and find the information you need to serve you and your families. So we're here to learn, and we're looking forward to promote healthy communities for Hispanics for a brighter future in Delaware. I'm very honored, and I would like to thank Secretary Landgraf to be one of our key champions. And I would like to ask her a question, which I will translate also in Spanish. You're a very busy person, and you have always found time to dedicate to our efforts. So what is your passion to join our journey of healthy neighborhood for Hispanics?
Well, Rosa, first off, I want to thank you for inviting me to be a member of the committee. I think it is so important that we outreach to the population so that people feel comfortable in knowing that we are here to promote health and well-being of everyone in the state of Delaware. As Secretary of Health, that is so important, and we know, that many people are impacted in the health arena. And many times individuals aren't even aware of the availability of services. So I appreciate being part of a committee that can actually inform and educate me relative to where the gaps are for the Hispanic population and how we can work together to fill those gaps.
Mi nombre es Ronaldo Tello. I'm the director of Delaware Hispano magazine, and I also have the honor to serve as a co-chair of the Health and Social Services Subcommittee of the Delaware Hispanic Commission. And I'm thrilled that we have put as a priority the area of mental health and addictions. And there are alarming numbers. We know that there is a big need. 15.9% of Hispanics adults reported suffering from mental illness in the previous year. But at the same time, only 1 in 11 Hispanics with a mental problem or illness really contact a mental health professional. So we know there is a stigma in our community that we have to educate the community and ourselves, but also in Delaware we talk about a crisis because of the shortage of bilingual, bicultural mental health professionals. There is hope. There are organizations that have been working on tackling these problems, such as the LACC or St. Paul's Family Counseling Center or Westside Family Healthcare, and actually the Hispanic magazine also through educating the people through articles. But we still need to do a lot more, so we invite you to be part of the conversation.
My name is Maria Matos, and I am the President and CEO of the Latin American Community Center in Wilmington, Delaware. I serve on the Education Subcommittee of the Commission. While the EL or English language population is ballooning, there is no longer any direct state funding for programming. Since 2003, the English language learner population has doubled in Delaware, with now more than 9,300 enrolled in our public schools, and the number is increasing. English language learners represent 81 native languages. Approximately 77% are Hispanics. English language learners significantly lag behind their peers in reading by 46%, in math by 35%, science by 36%, and social studies by 39%. There is also an alarming discrepancy in high school graduation and college enrollment rates. We must improve this condition in Delaware. We must also improve our Delaware teacher certification requirements to teach English language learners. There is hope. There is hope. The Vision Coalition of Delaware has been developing a vision for education in Delaware for 2025. ED25, which is what it's called, is a bold plan to better prepare all Delaware students for a lifetime of success.
My name is Claudia Pena Peretti, and I'm a proud member of the Delaware Hispanic Commission. I'm also the Executive Director of La Esperanza in Georgetown, Delaware. According to the recent U.S. Census, approximately 30,000 Hispanics live in Kent and Sussex counties. And recent studies show that more than 50% have household incomes at or below $30,000 per year. The good news is that Delaware Hispanics have a strong interest in improving their economic status, with more than 90% reporting an interest in job training, job placement, and starting a business. And even better news is that agencies throughout Delaware are partnering to provide services and programs such as English as a second language and financial coaching to help Hispanics overcome the economic barrier and live independently. What we know for sure is that by working together, we can help them reach their goal. Thank you.
My name is Tanetta Brown, and I serve as Associate Director of Health for the United Way of Delaware. Through our Community Impact Investment Fund, we support a host of community organizations and partners who equitably serve some of the critical needs of our Hispanic neighbors. And we do this in the areas of crisis alleviation, access to culturally competent health care and quality health care, mental and behavioral health supports, opportunities for individuals to age in place, as well as youth development, and we also support individuals with disabilities.